Evidence-based practice is the integration of the best available research with clinical experience in the context of patient characteristics, culture, and preferences. It is critically important to use evidence-based practice in any intervention with patients, including assessment, diagnosis, prevention, treatment, and consultation. Psychologists have a significant responsibility to provide the best care for patients. In fact, using evidence-based practice is expected in the Canadian Code of Ethics for Psychologists, as outlined in the Principle of Responsible Caring. We are expected to keep up to date with a broad range of knowledge and research and their impact on individuals and groups. We must regularly read the relevant literature, consult with peers, and engage in continuing education activities so that our practice, teaching, supervision, and research activities will benefit and not harm others. Due to busy clinics and long wait lists in many public systems, it can be tempting to maintain status quo and continue to provide treatments as usual. But is this really what is best for patients and the healthcare system as a whole? Do cancer care clinics provide generic chemotherapy and/or radiation for all types of cancers? Or based on evidence, do they provide specialized treatments for specific cancers? Do oncologists still use generic treatments with patients because it is what they have always done, or what has worked? Or are they starting to use immunotherapy and gene therapy because the treatments are more successful? If there are evidence-based psychological practices for mental health conditions or chronic medical issues, psychologists have an obligation to use them. Another major advantage to using evidence-based practice is that it is cost-effective, both directly and indirectly. It reduces costs to the healthcare system and increases productivity and quality of life for patients. Many psychologists working in the public system supervise practicum students and residents. It is our responsibility as teachers to be up on the latest literature and to model evidence-based practice for future psychologists. Ensuring that these students are fulfilling the role as a scientist practitioner within a clinical area is one way to translate training into practice. Using outcome measures to monitor progress with patients is only one way to conduct science in practice. Psychologists must be prepared to alter their approach based on data from ongoing treatment monitoring, as well as patient characteristics, culture, and preferences. With no shortage of work for psychologists within the public system, it might feel daunting to find time to keep up with the latest research in evidence-based practices. There are various ways that evidence-based practice can easily be integrated into one's workplace. To ensure that this practice is being utilized within my own department, many psychologists read peer-reviewed journal articles, participate in journal clubs, or attend accredited workshops. Others contribute to the literature by developing research programs that are integrated into their clinical areas by using outcome measures or newer technologies such as web-based therapy. Our Continuing Education Committee organizes excellent quality grand rounds by bringing in expert speakers. These rounds are not only available to members of our department, but invitations are extended to the entire healthcare community. One of the major benefits of working within a department of psychology is that one can consult with experts in various areas of psychological assessment and treatment who know the evidence-based practice within their areas. This website will serve as an easy-to-access, comprehensive resource to find evidence-based practice in many areas of psychology and support psychologists and students in their responsibility to provide the best care possible for patients, families, and the healthcare systems as a whole.